Thanks, Kevin. Our next speaker is Marie-France Hivert, who's assistant professor in the Department of Population Medicine at the Harvard Pilgrim Healthcare Institute. Dr. Hivert is a clinical investigator with a primary focus on the etiology and prevention of obesity and related comorbidities, particularly type 2 and gestational diabetes. She'll present on early infant rapid weight gain and the epigenetics of leptin. Dr. Hivert.
Thank you very much. Thank you to the organizing committee for inviting me to present on the topic today of epigenetic of leptin and early life weight trajectory. So I would like to start with a few words about what is leptin to make sure that everybody is on the same page. We heard that word a couple of times already today, but I want to touch a few words on the physiology of leptin in adult life, in pregnancy, and early life, and then talk to you about epigenetics of leptin in early life, and especially the impact of maternal glucose on epigenetic regulation of leptin. So what is leptin? Well, leptin was discovered in 1994, and it was really the first adipokine that was described, meaning a hormone that is specifically produced by adipocytes. And it was discovered with this mice called the OB mice. And the OB mice is fully deficient in leptin, hyperphagic, and morbidly obese, as you can see. In humans, a few cases of full leptin deficiency have been described, and just like in the mice, when we provide a leptin by injection, the kids who are fully leptin deficient then decrease their hyperphagic behavior and reduce their weight and continue to grow in height, but then almost can hope to normalize their BMI at some point. So from the animals and the human study, it was then known that leptin is adipostat signal that sent messages to the hypothalamus saying, well, if there is not enough adipose tissue and the leptin levels falls, we should increase our food intake and other adaptation to reinstate our normal weight. And that seems to be true in lean individuals. This negative feedback loop exists. Young adults that are lean that have relatively low leptin levels seems to have higher weight gain in the next couple years following the measurements of leptin. But this doesn't seem to be true in people who are obese, where a leptin resistance seems to appear. And even if we inject more leptin to obese individuals, there's this state of leptin resistance and no significant weight loss can be induced. Leptin also acts in many other systems, more importantly for today in reproductive system. And I would like to point out that there's data showing that leptin has action on the placental function and maybe on fetal development like we will see today. But even more interesting, leptin is produced by the placenta and not only by adipose tissue during pregnancy. And you can see here in this study that maternal placenta greatly contributes to the circulating level. At first trimester, there's almost double the amount of circulating leptin than the pre-gravid time, and this is way before there's significant adipose tissue gain in pregnancy. And right after delivery, within 48 hours after delivery, there's this rapid drop, meaning once again that this drop is due to the placental production and not the decrease in weight after pregnancy. So we could ask ourselves, why is the placenta producing so much leptin? Because it's supposed to be a negative feedback if we're thinking about the normal physiology. So we investigated that question. So in this talk, I will try to untangle what are the physiologic role of maternal leptin and fetal leptin. So from the numerous data, we think that during pregnancy, the maternal circulating level are about equally coming from the adipose tissue and the placenta. The placenta also produces a little bit of leptin that is sent on the fetal side, but probably most of what we measure in the circulation represent the fetal adipose status. And to investigate a few of those questions, I will use the data that we derived from the pregnancy longitudinal cohort that I've built in Canada, where we measured women at first and second trimester, and we could measure the maternal leptin levels at those 2 points. And at delivery, we have collected cord blood samples and placenta, and we measured the fetal levels. And so we know that women who are more obese have higher adipose tissue to start the pregnancy, and so they start the pregnancy with higher leptin levels. And then we were curious to know what was the correlation between maternal leptin levels and subsequent gestational weight gain. And we were surprised to see that actually it was not associated with lower gestational weight gain, but with higher gestational weight gain. So it seems to be this positive feedback loop, which is not that common in human physiology. And this was present mainly in the second trimester and with higher magnitude in women who are already overweight. So there's really seems to be a positive feedback loop coming from the maternal leptin levels signaling to women that they should be eating more. We also saw that maternal leptin levels were associated with fetal adiposity that we measured with skin folds and with higher fetal leptin levels in the cord blood at birth. But why do we care so much about leptin levels in the offspring in the perinatal period? That comes partly from animal studies that were published more than a decade ago. So Bure and al. And the group took mice that were OB and compared the hypothalamic development to normal mice and saw that in the periventricular nucleus of the hypothalamus, there was definitely a lack of neuronal development and projection. And when they injected leptin in the perinatal period to the OB mice, they could rescue and almost normalize the density of neuronal fiber and projection in the periventricular nucleus. They tried to do that later in life of the mice that were also OB, and this effect was not noticed. And so really highlighting that the leptin exposure in the perinatal period has a critical role. In a later similar experiment, they exposed the OB mice once again to a short course of leptin in the perinatal period and follow them through life to see their weight trajectory. You can see the normal mice here, the wild type in black, that stabilize their weight through life. The OB mice that were not treated, and so they are fully leptin deficient and hyperphagic and becomes morbidly overweight. And then if we inject leptin for only a few days in the perinatal period before here, the weight trajectory is slightly lower. You might say that it's not a huge difference, but it is statistically significant. And you have to remember that they were treated only for a few days in the perinatal period, and that had this lasting effect over life. They also showed that treating with leptin later in life the mice that were exposed to early leptin in the perinatal period were sensitive compared to the one that were never exposed. So they retained some kind of leptin sensitivity because of that early exposure. They also showed differences in adipocyte and adipose tissue development. And so this short course of leptin exposure in early life led to adipocytes that were smaller. And we know that small adipocytes are more metabolically healthy and flexible. And so that it seems like an early leptin exposure is not only associated with hypothalamus development, but also adipose tissue. What do we know from early leptin or perinatal leptin in human? Here in Project Viva, that has been led by Matt Gilman for over 15 years now, they investigated a series of factors in prenatal or at birth and their association with early infancy weight gain, here represented by weight full length between birth to 6 months. And among all the factors, once again, leptin emerged as one of the significant determinant of early infancy weight gain. And so this has to be interpreted as higher leptin level is associated with slower weight gain between 0 to 6 months. And when they looked at weight status at 3 years of age, they saw a similar negative association where low leptin levels were associated with higher weight status at 3 years of age. Continuing in childhood, they then looked at leptin levels at 3 years of age and the association between change in BMI between 3 and 7 years and BMI Z-score at 7 years. And then the association was not the negative association observed earlier in life, but seems to have a positive trend. So to try to summarize this later part, fetal leptin or leptin levels in the perinatal period is a critical period where the infant is still sensitive, and so higher leptin or lower leptin is actually associated with higher weight gain or higher adiposity at age 3. And that might be through hypothalamic development, through adipose tissue changes, and this morning we heard maybe also through the microbiome. Adiposity at age 3 is positively correlated with leptin levels at age 3, and then this might actually be positively associated with adiposity at age 7. Or at least we don't see that negative feedback that we would expect. Now diving a little bit more in the epigenetics of leptin. So my group is especially interested in the impact of maternal glycemia. My colleague, Luigi Bouchard, has looked at the association between maternal glucose and DNA methylation in the placenta from women who were all classified as impaired glucose tolerance. And you can see that the higher the maternal glycemia here, the lower the DNA methylation in leptin in the leptin promoter region on the fetal side. And then when we looked at the maternal side, the higher the maternal glycemia, actually the higher methylation in the promoter region of leptin. And so how can we interpret that in light of what I just told you? Well, if we do believe that maternal leptin has a positive feedback on gestational weight gain, we could hypothesize that higher maternal glycemia leads to an adaptation in the maternal side of the placenta with higher methylation in the leptin promoter, lower expression, which we did show in the placenta also And then that would be an adaptation to limit the maternal leptin levels to, since there's enough nutrient coming in, probably no need for that positive loop for further nutrient. But this is only a hypothesis. On the fetal side, the higher maternal glucose and lower methylation might actually reflect what happens in the overall fetus, because we know that the process of differentiation of adipocyte is also characterized by demethylation of the leptin genes. So leptin is highly expressed by mature adipocyte. But like it was said very elegantly this morning, association is not causation, and Caroline explained very nicely how to use Mendelian randomization to assess causality in the observational studies. And so we decided to use this approach to try to understand the association between maternal glucose and leptin epigenetic regulation. So in Gen3G, we have the maternal glucose, and then we selected the second trimester fasting glucose. We measured cord blood and leptin. We did see an association between maternal glucose and cord blood leptin. We then looked in the leptin region in about a dozen CPG sites and found that one of them was associated with cord blood leptin, and this is a negative association, like we expect in most of the time, which is not always true, like Rob said this morning, but lower methylation is associated with a higher level of leptin. And then we look if the maternal glucose was associated with DNA methylation at this CPG site, and we found a moderate association. We built the genetic risk score to represent maternal glucose based on what we know from genetics of glucose from non-pregnant and pregnant population. And this genetic risk score is moderate association, but like strongly significant given the fact that we have less than 500 people in there. And we use this as a instrumental variable based on the genetic framework, and we did show this association. So it seems that our instrumental variables support that maternal glycemia is part of the causal pathway influencing offspring leptin epigenetic regulation. So coming here, we did show that maternal glycemia seems to impact leptin levels in the perinatal period, and it's most likely acting at least partly on epigenetic modification. It would be interesting, just like Caroline highlighted this morning, to find other factors, and we can use different ways, but Mendelian randomization might help us to identify which of the factors we would like to intervene in priority in the hope to prevent the epigenetic programming here of leptin, but we could, just like presented this morning, model different type of outcomes at birth and throughout childhood. So a couple short take-home messages. So the perinatal period is critically sensitive to leptin, and it likely affect many tissues. So not only the hypothalamus, but probably also adipose tissue. The perinatal leptin levels are associated with early life weight trajectory, and it seems to be true both in animal and human observational studies. And based on the current literature, it seems like maternal glucose modulates epigenetic regulation of leptin in offspring. On that, I would like to thank all my colleagues and the staff at the Obesity Prevention Program, colleagues also at Harvard School of Public Health, Andrea, that you heard this morning, and my team in Canada who helped build the Gen 3G cohort and all the funding agencies.